Of licensing and occupations to order. Madam Clerk, please call the roll.
Representative All.
Here.
Representative Banta.
Present.
Representative Callaway. Representative Kleins. Representative Dietz.
Here.
Representative Donworth.
Here.
Representative Pfister.
Here.
Representative Flannery.
Here.
Representative Gentry.
Here.
Representative Hampton.
Here.
Representative Hevron. Representative Huff.
Here.
Representative Jackson. Representative Kulkarni. Representative Meredith. Representative Neighbors.
Here.
Representative Raymer.
Here.
Representative Smith. Representative Wilson. Chairman Cook.
Here. We do have a quorum to operate. We have several members that are next door in education. They're going to be running back and forth. So please excuse a little bit of activity as they do so. All right, we're going to get started, and we're going to start first with House Bill 566. I'm going to ask Representative Smith to take the chair, and I'm going to work my way to the table.
All right, Chairman Cook, if you'll introduce yourself and your guests, you can proceed with the bill.
Representative Matt Cook, 72nd District.
Hi, good morning. Jamie Eads with the Kentucky Horse Racing and Gaming Corporation.
All right, good morning, everyone. Thank you for being here on this snowy day. Last year, you'll remember Senate Bill 299, we created the Horse Racing and Gaming Corporation. And this year, we had a much loftier task because we had to implement how exactly that was going to run and how it was going to work. So we've spent 8 months working on this product and getting us to where we are today. So pretty lengthy bill. I'm going to break this down into 3 groups, and I'm going to start first with the charitable gaming. I think that's kind of the elephant in the room. I think it's fair to say there was a lot of anxiety from charitable gaming with the move, something new coming down. So let's start with what we did there. We listened to their concerns, and here are some of the big changes for them. The first thing we did is their tax or their fee structure. We actually locked that into statute. It's actually at a slightly lower rate than it was. It's going to save charitable gaming a little bit of money there. That's something that they were very worried about going up under the new organization, but that is locked in statute and not moving. We increased the representation on the board up to 3 members. They request for more representation, and that will become effective immediately. Every game that they have, their technology, we're talking technology here and what they're using, on place on July 1st, 2025, remains intact, can only be changed by the General Assembly. And then common school districts can get an annual license. We had several public schools needed some clarification and wanted some work on their charitable gaming. So now at the district level, they can apply for a charitable gaming license. And then if the band boosters, any club, football team, etc., they can run their charity through the district level license and then do all the reporting that's always been required as far as the quarterly reporting. We made no changes on the reporting, just the actual license will be held at the district level. Okay, moving on, self-funding the corporation. This was a very large undertaking. Now that we've created the corporation, we had to figure out how they were going to be taken care of and that there was no general fund money going over there. The biggest is there's 10% out of each fund, up to 10% out of each fund can be used for the administration. There are several funds that are on there. So this is your Kentucky Thoroughbred Development Fund. This is your Standardbred Breeders Fund. This is your Quarter Horse Funds. This also includes sports wagering. The board, when they do an annual budget, they will look at that each year, and they will decide how much up to the 10% threshold. Big deal is there that 90% will be going straight back to the breeders, etc. Setting up the board, we added a quarter horse member along with the charitable member that came onto the board to keep, you wanted that number to be an odd number, so it's 17. We staggered the board with 4-year terms. So first 8 the first year, and then 9 the next year, years 2 and 3, and then they'll rotate every 4 years. That way you never lose the full board at one time. Uncashed vouchers at the track. So I think most of us that have served on L&O for a while know about uncashed pari-mutuel wagering tickets and what happens with them. With the HHR facilities, we have uncashed vouchers. So we needed to lay out what actually happened to that money. That money was kind of sitting in a hold, and we needed to designate what was going to happen with those funds. So 10% of that will continue to go to Problem Gaming, Representative Meredith. I know that's been a big deal for us as we've looked at sports wagering and everything else. So continuing to fund that. 65% will go to backside improvements, and 25% will go to administration and regulation of live horse racing. Another big part of that, we've had some discussion about the investigators, whether or not they're POP certified, whether or not we have the investigators. So the investigators are very, very important to what's going on here, but we've tried to make this a more efficient organization. So by doing so, the first thing we did is we said that they may be POP certified, because there's not a necessity for every one of them to be POP certified, but this also allows them to grandfather and bring over the experience that they have at charitable gaming, so they can come into it and into the future. If they find the right individual that's POP certified, they might hire them. If they find somebody who's not POP certified but it's right for the position, they may hire them. And the important thing here is this is going to allow them to go across all sectors. It won't just be for charitable gaming. They'll be able to do horse racing, sports wagering. You'll have an investigative department, cross-trained, and increase the efficiency of the department. So we think that's going to be a good move for them. Third part of this, big part of this, is quarter horse racing. We've had lots of discussion in this room getting the quarter horse racetrack up and going. They've had their meet the last, 3 springs has been at the Red Mile. They're currently building a new racetrack out in eastern Kentucky. We've established a quarter horse racing breed registrar. We've also put an incentive in here. We don't have enough quarter horse race mares. When you look at horse racing, the brood mare is the economic driver. You've heard Damon Thayer talk about this an awful lot. The brood mare is the economic driver that goes on in here. We needed more quarter horse racing brood mares in the state. So we've put a clause in here for the next 3 years. You can go out of state, purchase a quarter horse mare. We've created a pathway for those next 2 foals. Those next 2 years, you have to breed her back. There's going to be regs that have to be established in this process as well, establishing what an accredited bred Kentucky stallion might be. But they'll set this up, and you'll have what we're going to do is we're going to go from a very small crop of quarter horse racing brood mares in the state. We're hoping this provides a boom and increases those numbers. And what's important here is for anybody that wants to take interest and interested in doing this, you're going to be running for some pretty large quarter horse purses here in the next 3 to 4 years. I think there's over $4 million in that account already. 6-day race meet, and then, if we can get that up to 300 foals or something the next 2 years, that would be absolutely fantastic. Important thing here, very important note, that does sunset. Okay, that's only on the table for 3 years. We're not leaving this open-ended. We want Kentucky quarter horse racing to be able to stand on its own and be its own product here. We're just we looked at this, we said, how can we get the numbers in here quickly and get this up and off the ground? And this was an idea that we had to do that. So everything else, there's a lot of details.
Motion on the bill.
Here. Okay.
Second.
Okay, before we do that, Mr. Chairman, this is a sub. Do we need to adopt the subcommittee?
Yes, sir. Thank you.
Okay, we got a motion on the sub, and we have a second, Representative Pfister, and you can go ahead and take the roll on the sub. Okay. Oh, voice vote. All in favor, say aye.
Aye.
All against, it passes.
Could somebody please tell us what's in the sub?
Oh, you just heard it.
Okay.
Well, yeah, there's two changes on the sub. One was on the voucher language. There was some confusion about the pathway, the money. The money went from we wanted to make sure that money was staying with each track facility. A little bit confusing down in the subsection, whether it went from the track to the corporation back to the track, and we intended that to stay at the track, so we corrected that language. And then also on the school districts, where we made the license for the school district itself. Those were the only 2 changes on the sub.
Thank you.
Okay, Representative Gentry.
Thank you, Mr. Chair. Or the chair standing in. Good morning, Mr. Chair. First of all, I want to say a couple of things and start with my questions. You guys know, and Senate Bill 299 last year was a very difficult bill for me. advocate of horse racing. I'm also a huge advocate in the nonprofit world and charitable gaming, and I was really scared about the structure that was getting put in place as it related to charitable gaming. And even though I still think that we should have went a slightly different direction on how we formed this, that's water under the bridge. And now my focus the last couple of months has been on what can I do to help make this work the best it can work. I want to thank Chairman Cook for working with me and keeping me updated on things that have been going on, including the sub that came in real quick. He explained all this to me last night, and I already knew this sub was coming. I hope that communication continues. Really appreciate it. Also appreciate many things that are in this bill. The quarter horse pieces are really good, very, very much needed. Also, as it relates to charitable gaming, I think there's some things in there that the charitable gaming people need to be are pleased about. So I want to make sure I say that too. There are the first question I have related to charitable gaming, and I know you mentioned something about the charitable gaming fees. I apologize. I was writing something down, didn't catch everything you said there. So if you would, could you repeat what the fee structure is, and also the merit employee protection part in KRS 18A seems to be removed, and could you address that, please? Thank you.
Thank you, Representative Gentry. The Senate Bill 299 initially had taken everyone, the Racing Commission and all of its assets out of, or all of its employees out of 18A. And it was, my understanding was the intention for all of that to come out, and it was left in one spot in the charitable gaming chapter 238. And so this just clarifies that and puts us all in the same type of employment, which is at will.
And they still maintain all their state, the healthcare, state retirement.
Deferred comp, they have the ability to participate in deferred comp, and they have health and dental vision. It's just the 18A.
And then we also, on the charitable gaming fees themselves, we locked that in the statute. And off the top of my head, without going through the bill, I believe it's 0.545 is the tax rate that we locked that into. But I'd have to go back and look at the bill. It's very close to that. Charitable gaming was very pleased with having that locked in the statute and not being, and they would, in the past, they would look in the fall, and then that would fluctuate, what that number was actually going to be. So we took the lower number and locked it in.
Okay, could I get a follow-up question, please?
Yes, go ahead.
Also in Section 8, and you also referenced this about the peace officer situation there. Can you explain exactly why you did that, removing the peace officers? And I know you mentioned that again, so I apologize. It kind of went through me real quick. So if you could just, or Jamie, I'm sorry.
Thank you, Representative. So the Section 8 that you're referencing, I believe, refers to the peace officers at the racetrack, our enforcement team in racing, which they have historically had that ability but have not exercised that. And so I think later in the bill, you can correct me, I think that there is an enforcement team that's envisioned where there could be some that are POP certified and peace officers and some that are not, depending on what the needs are. I know that Representative Cook worked really hard to bring in the charitable gaming folks over with their certification so they can remain in that category. And then it gives the corporation some flexibility to, on future hires, to decide what works best for the needs. Re-envision an opportunity to sort of cross-train so that somebody that's going to the racetrack could also go to a sports wagering book or could go to an HHR facility or to one of the charitable gaming locations.
So just one department cross-trained serving all entities streamlines the process.
Thank you very much for that. Thank you, Mr. Chair.
Okay, we have another question from Representative Donworth.
Thank you, Mr. Chair. First of all, I wanted to say thank you. This has clearly been a labor of love to get this bill together, and I want to commend Chairman Cook for working with all of the stakeholders to get this comprehensive piece together. I wanted to ask a clarification question. Hold on, let me find my notes really quickly. It does exempt employees and board members from ethics rules under KRS 11A, unless they're otherwise exempted in the bill. Could you explain kind of what those exceptions are and the reasoning behind it?
We went with stricter, talking with Chairman Petrie and going through everything there. There's a lot of money on the table, so we actually pulled that language over from lottery, and then kind of morph the two together. Do you have any comments on your board and the comments on how tough it is now versus what it used to be for them?
I mean, I think I do think it's a stricter, a higher standard, which is necessary for what we're working with. Some of the board have made comments about it, but I think it's where we are, so it'll be fine.
Great, thank you.
Any other questions? If not, we have a motion and a second on, do we need to? Okay, we're going to take a new motion and a second because of the sub, so we have a motion on a new motion here. Okay, we got a motion and a second. And now we'll take roll on the bill on House Bill 566.
Representative All.
Yes.
Representative Banta.
Yes.
Representative Callaway. Representative Kleins. Representative Dietz.
Yes.
Representative Donworth.
Yes.
Representative Pfister.
Yes.
Representative Flannery.
Yes.
Representative Gentry.
Explain my vote, please.
Yes.
Again, as you know, I had issues with the structure last year, and I'll continue watching this. I do like a lot of things that are in this bill. I think this is a great start, and good luck, Jamie. I'll be a yes today, and I will keep watching and keep doing what I can to allow all the people to have equal access to what they need. Thank you.
Representative Hampton.
Yes.
Representative Heverin. Representative Huff.
Yes.
Representative Jackson. Representative Kulkarni.
Yes.
Representative Meredith. Representative Neighbors.
Yes.
Representative Raymer.
Yes.
Representative Smith.
Yes.
Representative Wilson. Chairman Cook.
Yes.
The bill passes favorably, and so shall on the floor. Thank you, Mr. Chairman.
Just thank you, Mr. Chairman. Real quick, I'd like to say thanks to Bryce and Christy. They did an incredible amount of work on this, and I don't think we say thank you enough to the staff sometimes. They were absolutely incredible putting this together, so thank you. Next up, Representative Neighbors. Will you move to the table, please? May introduce yourselves for the record, and you may begin.
Thank you, Chairman. My name is Amy Neighbors, and I represent the 21st House District.
Derek Lewis, represent the 90th District, Leslie, Clay, and Laurel counties.
Would you like to?
Yeah, I'll go first. So this bill originated out of administrative regulations. It was dealing with sign language interpreters. It came up, I want to say around October or so, but it was based on the Educational Interpreter Performance Assessments, one of the assessments that they take. It is no longer nationally recognized, program. And of course, with interpreters, I learned a lot. They can go on and advance their degrees. In this case, so this bill affects about 500 interpreters in the schools in Kentucky. And Representative Neighbors, she had a constituent that reached out to her and took the initiative to address the issue. Representative Neighbors.
So, as Representative Lewis mentioned, this bill was brought to my attention and drafted with much assistance with a constituent from the 21st District who she herself is also a sign language interpreter. Her concern when she called me last fall to discuss this legislation was the shortage of interpreters for our school systems across our state. So through many conversations with her and other stakeholders, such as the Kentucky Registry for the Deaf, we came up with this solution to create a third type of interpreter's license for educational interpreters. We believe this third type of license will help the shortage and will be less burdensome for this type of interpreter to obtain. This third license would also protect deaf consumers and hiring entities by clearly identifying the skill sets that a licensee has demonstrated on a national level assessment. Hiring entities are often confused by the difference between the types of qualifications and certifications available. This third license, administered by the Kentucky Board of Interpreters, would allow experts in the field to determine the qualifications needed to work successfully in an educational setting and allow consumers of services to easily identify interpreters that have specialized in educational interpreting versus interpreters who work in a wider variety of settings. That concludes my remarks on this bill, but if you all have any questions.
Motion on the bill.
Before we do that, that was a committee sub that was just described, and motion on the sub. And a second. Is that a question, Representative All?
Yeah.
We have one question here.
Yeah, I'm the committee sub. I'm reading the differences. It looks like you just basically expanded the definition and put some framework around what passing the grades was. Can you explain briefly the committee sub?
Sure.
I can get this one.
Go ahead.
Real quick, I'll just say I originally started drafting this and thought I had a great solution, and the other organization it affects did not think so. So Representative Neighbors, she took care of it, and that's where the committee sub came from.
Okay.
Yes, it does. It does create that third license as they had requested.
Okay. Thank you.
And Representative Neighbors, I apologize because I was supposed to tee this off by saying that we had a letter sent in to us this morning with concerns, but none of that pertained to the original bill, and Representative Neighbors had fixed all of Representative Lewis's mess ups on that. And committee sub answered all those questions that were on there with that. So that being said, we have a motion and second on the sub. All those in favor signify by saying aye. All opposed, nay. Committee sub carries. Any further questions or comments? If not, we need a motion on the bill. We have a motion by Representative Pfister. Is there a second? Second by Representative Banta. Clerk, please call the roll.
Representative All.
Yes.
Representative Banta.
Yes.
Representative Callaway. Representative Kleins. Representative Dietz.
Yes.
Representative Donworth.
I'd like to explain my vote, please.
Yes, ma'am.
All right. Thank you all for addressing those concerns that were shared. I think this is a really great cleanup bill with the amendment sub is a great cleanup to the original draft. So I am in favor. Thank you. Yes.
Representative Pfister.
Yes.
Representative Flannery.
Yes.
Representative Gentry.
Explain my vote briefly. Yes, sir. Just want to say that this is a great opportunity to say this is the way government's supposed to work, and why it can be very slippery slope if we try to move too quick, because there's unintended consequences created. It was addressed, it was fixed, and that's why we need to move methodically when we pass bills. Good job. Thank you. I'm a yes.
Representative Hampton.
Yes.
Representative Heverin. Representative Huff.
Yes.
Representative Jackson. Representative Kulkarni.
Yes.
Representative Meredith. Representative Neighbors.
Yes.
Representative Raymer.
Yes.
Representative Smith. Representative Wilson. Chairman Cook.
Yes. Bill with committee sub passes. Look forward to hearing it on the House floor. Thank you very much.
Thank you.
Okay. Representative Vanessa Grosso, make your way to the table, please. First time in front of L&O. Is this your first bill to come through committee? Second bill. Perfect. Well, you know what to do then. Make sure your green light's on, introduce yourself and your guest for the record, and you may begin.
All right. Thank you, Mr. Chairman and members of the committee. I'm Vanessa Grossel, State Representative for House District 88, which covers parts of Fayette and Scott counties.
Good morning. Whitney Duddy. I represent the Kentucky Academy of Nutrition and Dietetics.
Hi, I'm Anna Hartman. I'm a registered and licensed dietitian. There we go. I'm Anna Hartman. I am a registered and licensed dietitian, and I'm the president of the Louisville Academy of Nutrition and Dietetics.
Welcome. You may begin.
And we have one more who's joining us via Zoom from the Council of State Governments, Caitlin Bison.
All right.
All right.
You may begin.
Thank you. I'm here today to present House Bill 70. It's an interstate compact relating to dietitians. This allows for reciprocity with other states that have signed on to the interstate compact. And we've done these for a number of other professions. Have with me here a dietitian who practices out of Louisville and has some clients who request services from Southern Indiana as an example. Also want to mention to the committee, we received a letter yesterday of support from the Department of Defense, as this impacts a lot of military families. And I'll turn it over to Whitney for some remarks.
Very briefly, thank you for your time today, Chairman and Committee. I too live in Edgewood, Kentucky and work in Cincinnati, so do have the same as Anna. But briefly, our bill has many benefits that I think are for the Commonwealth, our citizens, and our dietetics profession. Number one, workforce development and a strong labor market for the dietetics profession, including, like the Department of Defense supports, employment flexibility for the relocation of our military and their spouses. Additionally, we anticipate expanded patient access through qualified practitioners and promotion of telehealth services, reduced administrative burden for our licensure board, and preservation of state sovereignty. And thank you for your time.
Are there any questions from
Motion on the bill?
All right. We have a motion on the bill from Representative Banta, second by, is that Representative Meredith? Representative Huff. Representative Huff. All right. Any further questions? If not, clerk, please call the roll.
Representative All.
Yes.
Representative Banta.
Yes.
Representative Callaway. Representative Kleins. Representative Dietz.
Yes.
Representative Donworth.
Yes.
Representative Pfister.
Yes.
Representative Flannery.
Yes.
Representative Gentry.
Yes.
Representative Hampton.
Yes.
Representative Heverin. Representative Huff.
Yes.
Representative Jackson. Representative Kulkarni.
Yes.
Representative Meredith. Representative Neighbors.
Yes.
Representative Raymer.
Yes.
Representative Smith. Representative Wilson. Chairman Cook.
I'm a yes. Bill carries. Look forward to hearing it on the House floor. Thank you, ladies.
Thank you all very much.
Okay. Next up, House Bill 72, Representative DJ Johnson. You want to move forward to the table, bring your guest, introduce yourselves for the record, and you may begin.
Good morning, Mr. Chairman, committee members. I am DJ Johnson, State Representative for the 13th District. Tom, would you like to introduce yourself?
Yes, thank you, Mr. Chairman, members of the committee. My name is Tom Underwood. I'm the Executive Director of the Kentucky Podiatric Medical Association.
Hi, my name is Angie Stewart. I'm the Director of Operations for OrthoCincy.
Hi, my name is Kelly Holden, and I am in-house counsel for OrthoCincy.
Mr. Chairman, we are here this morning, and I'm here to present to you House Bill 72. House Bill 72 modifies KRS 311B.020, which deals with qualifications and activities concerning medical diagnostic imaging professionals, including, among others, limited X-ray machine operators. Currently, under this statute, limited X-ray machine operators are not allowed to perform their duties in the same facility as other imaging equipment, in a facility where other imaging equipment is being used. What this one requirement has caused is pretty impressive. First, effectively, to be legal, a medical practice who currently had an x-ray technician working in their facility, when the statute changed, they would either have to do one of three things. One, move their x-ray machine to a new facility, which is not feasible. Two, fire potentially a long-term employee, the x-ray technician, because they wouldn't be able to stay in the same building as the other equipment. Or three, simply be out of compliance with the new law. This did not make sense to me, to be honest. Another impact on this is the training of x-ray technicians. With the situation we have, the practices were effectively unable to hire x-ray technicians if they had the other imaging equipment in their facilities. This nightmare has mandated physical separation, causes training opportunities. They've almost disappeared. Basically, I think this is unnecessary. So what House Bill 72 does, it very simply, allows x-ray technicians to operate in the same facility as other imaging equipment.
Motion on the bill.
We have a motion, but we have two questions first. Representative All.
Thank you, Mr. Chairman. I think that all of us have probably had our inboxes flooded from various students from across the Commonwealth, KCTCS mostly, from Owensboro, Bluegrass, all the above. Why are they so, fired up and against this bill?
I think what I'd like to do is allow the ladies that are here with me, who are in that industry, in that profession, to provide the perspective to answer your question. And if you still have a question, I'll be glad to take a shot of it from our perspective.
Yeah.
But I'd like to hear from them.
So for us, we are not considered a clinical site for the schools because we don't have all the same modalities that the schools need in order to be considered a clinical site. Yes, the students do come through our practice, but when you're considering the number of clinical sites that you can house students in, we're not included in that number because we don't have portables, we don't have an ER, and we don't have, we don't do surgeries in our facility. So really what they're fighting against is different than what we can provide.
And just to address it a little bit further, so there's a huge shortage of x-ray technologists across the state. Having an LXMO who could work in our facilities, because right now we're prohibited from having them in all but 2 facilities because we do have MRIs and CAT scans, so we cannot have a limited machine operator in our facilities based on the current bill. If this bill would pass, we would be able to use an LXMO, which would greatly increase our recruiting and allow us to have technologists. At this point, we're hiring contracted labor at 3 times the cost it would be to employ somebody, and you just don't, quite frankly, have the same amount of for someone who's a contract employee versus a regular employee where we're offering benefits and things too. So, for students, if you're a contract labor, you're going to make, quite frankly, a little bit more money because it's a supply and demand issue. And right now, the supply isn't good and the demand is huge. At any given, right now, we currently have 6 open positions for radiologists. And our Angie, our director of operations, and our COO said we'd hire 9 today if we could. We just don't have enough. This would allow us to recruit at a different level and to have people just operate our standard x-rays so we could use our other registered technologists to operate the more complicated machinery.
I am a licensed radiologic technologist, so I certainly understand the value, but I also see the value in the LXMO, and they should not be diminished in their role.
And I guess, Representative, I would just add that one of the concerns that I have seen, actually I haven't received any of these emails, so I'm going a little bit by hearsay, but there's a concern about students being placed into a practice. They have to go through a certain amount of in-house training in the practice. LXMOs are not certified to supervise those students, and they're afraid that if an LXMO comes into a practice, then it might limit the ability for the students to come into that practice. As you've just heard, in their case and in many cases, it's actually a moot point because they don't have the students coming in for certification anyway. And the other facilities that are allowed to bring the students in for certification already have the other higher advanced and training technicians who can supervise these students, and bringing in an LXMO or allowing them back into the facility would not impact that issue at all. And I think that's the main issue that they brought to you.
Just to follow up, Mr. Chairman, so you could hire people today to do these jobs. They just have to have that higher level of certification, so it costs you more in your facility to do that.
Well, we cannot find them right now. So when all the schools are in the area switch from associates to bachelors, it diminished. I mean, it really took us down.
This is a common problem we have with an infinite number of professions.
Correct.
You know, we're talking about veterinarians, we're talking about nurses, physicians. I mean, this welders, you name it. It's a problem across the board right now in the country. I have a different line of question, if I may, Mr. Chairman. There was some concerns about the hospitals and the levels. The Kentucky Hospital Association, the Kentucky Physicians Association, is anybody aware of their stance on this legislation?
I have not asked them for an opinion on it. I did talk to my local hospital, Once Rural Health, and their position was neutral, and because they effectively don't use LXMOs in the capacity that they provide the services they provide. So it's almost, I don't want to say two different worlds, but I don't know a better term. There's the ones that can use LXMOs effectively, and there's the ones that have chosen not to. I think the point I'd like to make is that it should be the private sector's choice whether or not they want these x-ray technicians in their facility or not. Right now, with the current language, they don't have that choice. With the new language, they would have that choice.
Thank you.
Representative Meredith.
Thank you, Mr. Chairman. And I have read through the bill, and we've talked about this, Representative Johnson, but again, we've gotten a lot of emails, and I just want to clarify for the record, nothing in this bill will extend the scope of what a limited x-ray machine operator is allowed to do. Is that correct?
That is absolutely correct. And in fact, I intentionally asked for language to strengthen the restrictions on LXMOs, make it absolutely clarify what they can and cannot do.
Mr. Chairman, if I might just follow up with that real quick. So what this bill does in its entirety is it just allows both license levels to operate in the same building if the equipment for both is there.
Correct.
No extension of scope of practice. We're just allowing people who are licensed to operate the machines that they're licensed to operate inside of the same building.
Exactly.
All right. Just wanted to make sure and have that on the record. Thank you, Mr. Chairman.
Representative Donworth.
Thank you, Mr. Chairman. I think that kind of answered my question, but I did speak with a hospital executive. I did not speak with the association, but they expressed some concern that this could potentially allow job applicants to claim that they had the ability to work on higher level machine equipment than what they were actually licensed to be able to do. So they expressed some concern. Could you address that?
Yeah, so similar to what Representative Meredith said, we're not expanding their scope. They're still operating the same machines that they're allowed to operate in a different facility. We just happen to have a fluoro machine and an MRI machine in our building that we're not asking for them to operate.
Okay, thank you.
Representative Raymer.
Thank you. So Representative Meredith pretty much hit the point that I wanted to make. I think it's important to note that every medical professional has their scope of practice. I'm a registered nurse. If I'm in the operating room with a medical doctor, I know what my scope of practice is. He knows what his is. You know, different professions work within the same facility every day. This is how medical community operates. So I just wanted to reiterate, we are not changing scope of practice, and them working together does not put patients at risk like we've seen in the email. So I just wanted to follow back up on that. Thank you.
Is there a motion on the bill? Motion by Representative Neighbors, second by Representative Flannery. Clerk, please call the roll.
Representative All,
Yes.
Representative Banta,
Yes.
Representative Callaway, Representative Kleins, Representative Dietz,
Yes.
Representative Donworth,
Yes.
Representative Pfister,
Yes.
Representative Flannery, Representative Gentry,
Yes.
Representative Hampton,
Yes.
Representative Heverin, Representative Huff,
Yes.
Representative Jackson, Representative Kulkarni,
Yes.
Representative Meredith, Representative Neighbors,
Yes.
Representative Raymer,
Yes.
Representative Smith.
Mr. Chairman, I'd like to explain my vote. I'm a yes, and I think we're going to keep seeing more and more of this, as has been pointed out in some of the testimony. And I think that we need to. We need to have all these different organizations come before us, tell us what the needs are, because we do have a shortage. We still have a shortage in nursing, and but we still have public protection that we need to be the top priority. So I appreciate the explanations, the interaction that we've had today, because it cleared it up for me that we're fine doing this, that it's still safe, and we're able to do it, and it benefit our medical part of it. So I'm a yes on the vote.
Representative Wilson. Chairman Cook.
Yes. Congratulations, Representative Johnson. Bill passes. Look forward to hearing it on the House floor.
Thank you, Mr. Chairman. Thank you, committee members.
Representative Mosier, want to make your way forward? You can just make sure your green lights are on. Introduce yourselves for the record, and the floor is yours.
All right. Thank you, Mr. Chairman. Thank you, committee. I am Kim Mosier, State Representative for the 64th District, and I'll allow my guest to introduce herself.
Leslie Sizemore, Associate Vice President of Workforce and Economic Development for the Kentucky Council on Post-Secondary Education.
Okay. So House Bill 79 is a really easy little bill. It allows the licensure boards to collect data around, we know who's licensed, but we don't know who's actually working out in the field. We do have a healthcare worker shortage, which Representative Smith alluded to in his last comments on the last bill. And so this allows the licensure boards to understand who is actually working and in what capacity in the state, and just collect licensure data that will be delivered to CPE and to the cabinet.
Motion on the bill.
Representative All.
Yes.
Representative Banta.
Yes.
Representative Callaway.
Aye.
Representative Kleins.
Hi, I'd like to know.
Tell you what, let's just vote this one, and then we'll take a break, because there's going to be several members come in. So vote this one, and then on the next one.
Okay. I just want to know my presence, and then yes.
Yeah.
Okay. Representative Dietz.
Yes.
Representative Donworth.
Yes, thank you.
Representative Pfister.
Yes.
Representative Flannery. Representative Gentry.
Yes.
Representative Hampton.
Yes.
Representative Heverin. Representative Huff.
Yes.
Representative Jackson. Representative Kulkarni.
Yes.
Representative Meredith. Representative Neighbors.
Yes.
Representative Raymer.
Yes.
Representative Smith. Representative Wilson. Chairman Cook.
Yes. Congratulations, Representative Moser. Bill
Absolutely.
passes. Moves to the floor.
Thank you so much, and thanks to my guest for standing by. Mr. Dale Bertram was online, so thank you for being here. Thanks.
All right. Thank you. Representative Lewis, while you're coming back up to the table, we've got a few members who just came back in. We want to make up several votes here. So we got Representative Callaway, Representative Kleins. I tell you what. Well, let me roll through you two real quick. I'll call it out, and then you can each do your vote. What's that? Oh, so you want to do vote two? Okay.
She didn't miss any votes.
Yeah, you made every vote. Oh, record that you're here. Got it. Representative, House Bill 566.
Yes.
Emily?
Aye.
House Bill 39,
Yes.
Aye.
House Bill 70,
Yes.
Aye.
House Bill 72.
I was going to pass.
Pass, okay.
Aye.
So he's a pass, she's an aye. And they just both made 70, 79, so 811. I'm just checking to see if you voted. Just
Chairman, and Chairman, and of course my presence, I didn't say, but, okay, thank you.
Thank you, Chairman, members of the committee. This is a pretty straightforward bill. It's 6 words total. Again, I mentioned earlier, chairing administrative regulations, oftentimes health regulations come through our committee. A few years ago, we had the expansion of Medicaid for dental, hearing, and vision. And during that time, I did a deep dive and really looked at what we were facing in the dental industry in Kentucky. Currently, we rank 49th. There we go. All it does is it allows dental hygienists to work for FQHCs and get the kids in school, or get the kids treated by FQHCs in schools.
he's still talking. I'll let him keep moving.
Just explaining the bill, Chairman. I'll be quiet now.
We have a motion and a second on our honorary member Derek Lewis's bill. Any questions, comments? Clerk, please call the roll.
Representative All.
Briefly explain my vote. I
Yes, sir.
want to commend you on this piece of legislation. I worked at UK for a number of years and worked with the FQHCs through there, and so they're vital in our rural communities to provide health care in places that are challenged. And so thank you for this legislation. I'm proud to vote yes today.
Representative Banta.
Yes.
Representative Callaway.
Aye.
Representative Kleins.
Yes.
Representative Dietz.
Yes.
Representative Donworth.
Yes.
Representative Pfister.
Yes.
Representative Flannery. Representative Gentry.
Yes.
Representative Hampton.
Yes.
Representative Heverin. Representative Huff.
Yes.
Representative Jackson. Representative Kulkarni.
Yes.
Representative Meredith. Representative Neighbors.
Yes.
Representative Raymer.
Yes.
Representative Smith. Representative Wilson. Chairman Cook.
Yes. Motion carries. Bill passes. Look forward to hearing it on the floor. Thank you for your
Thank you.
compelling testimony.
Thank you, Chairman, members of the committee.
Motion to adjourn. All in favor, signify by saying aye. Aye. We're adjourned.